In my previous episode, I highlighted how many of the chronic diseases such as diabetes, coronary artery disease, asthma, allergies, and dementia are strongly linked to underlying immune dysregulation and inflammation. This episode is going to be more structural and foundational. You're going to meet your own immune system here. No, it's not a lecture series on immune system, but rather a quick guide to understand your body better. Immune system works round the clock trying to protect you from various dangers, not just infections, but also from saving you from developing cancer. Understanding the framework of immune system helps us in more ways than one. For some, it may mean confidence in discussing their lab reports with their doctors. For some, it may mean better understanding of their diseases and the treatment offered. This information here today is also going to be a useful information for future videos. Hi, I'm Dr. Aruna. I'm a pediatric rheumatologist by profession. I treat patients with inflammatory and autoimmune conditions. It's my passion to see beyond the symptoms and to help people understand their bodies better, what is the immune system doing in the background, because I truly believe that understanding what the immune system is doing in the background helps you to clear a lot of your doubts regarding your health. Immune system is not just a single organ, but rather an intelligent network which consists fundamentally of two different arms. One is the innate immune system, the other is the adaptive immune system. The innate immune system is quite ancient by evolution. It really dates back to millions of years. In fact, plants and insects also have versions of this. There are certain characteristic features of innate immune system. One, it really acts very rapidly, starting its action within seconds and minutes. Number two, it's quite generalized in its response, which means that to a wide varieties of stimulus, the response is going to be very similar. Number three is that it holds no memory, which means that once the stimulus dies down and represents itself, it's going to start its action all over once again in the very same fashion. There are certain cells which are included in this. These are notably neutrophils, macrophages, mast cells, dendritic cells, natural killer cells, and we are soon going to be introduced to them. These immune cells arrive at the scene of injury or infection and start their action immediately by starting to engulf the organisms and by starting to send out the danger signals to the rest of the immune system. Adaptive immune system is evolutionarily younger. It has two characteristics. One, it's very specific, and two, it can hold memory. It can identify particular molecular signatures very well and potentially can remember them for life. Lymphocytes are the cells of the adaptive immune system, and these are of two kinds, B cells and T cells. These cells can get activated from the cells of the innate immune system when they carry antigens on them. Antigens are nothing but non-self particles. Although a network, immune system operates from certain bases in the body. Let's look at them. Bone marrow. Bone marrow is a spongy area in the bone from where all the immune cells of the body are born. These are born out of mother cells called hematopoietic stem cells, a name that you may identify with bone marrow transplant. Bone marrow biopsy is a commonly utilized test whenever there are concerns regarding the number of immune cells in the body, whether they are high or whether they are low. It's not just the production, but B cells here also undergo maturation. If they are found to be too reactive, as in if they are attacking the self itself, they are eliminated from the circulation. If this were not to be the case, the body can start attacking itself, a process called autoimmunity. Thymus is a little organ situated in the chest. It is functional only in the childhood years. It is here where the T cell maturation happens. Each body has got its own immune signature molecules called MHC. These are like identity cards. T cells here are trained to identify our body's MHC. This helps them to identify self from non-self. It's a highly selective process here. T cells that fail the test are eliminated. It's important to note that thymus devolutes or becomes non-functional by middle age. This makes elderly individuals more susceptible to autoimmunity because they have less robust T cells. Lymph nodes. Lymph nodes are tiny nodular structures that are present in the body. There are about 500 to 700 of these in each body. They are often seen in areas of neck, chest, abdomen, groin, armpits. These get swollen up during times of infection, inflammation, and malignancy or cancer. Lymph nodes serve as intelligence analysis center. They are connected through the network of lymphatic system, a system that carries lymph, which is the tissue fluid. This tissue fluid is rich in immune cells as well as cellular debris and pathogens. In lymph nodes, there is an analysis that happens of the tissue fluid to identify the dangers. If found, the lymph node alerts the rest of the immune system. Spleen. Spleen is the organ which is situated in the abdomen on the left side. Spleen does something which the lymph node cannot do. It samples the blood. Lymph nodes sample tissue fluid or lymph, and spleen samples the blood. It looks for antigens in the blood and also helps in removing old and fragmented red cells as well as lymphocytes. Mucosal associated lymphoid tissue, MALT. Now, the gut, urogenital system, and respiratory system have their own specialized immune system in the form of MALT. In the gut, they are called GALT, gut-associated lymphoid tissue. Vast number of lymphocytes are embedded in gut lining. You'll be surprised to know that 70 to 80% of all immune cells reside in the gut. Why is this so? Because gut is the single largest interface between body and the external world. Every day, trillions of bacteria, number of food particles in the form of antigens, and several other antigens are presented in the gut to the body. Each day, our immune system has to make billion decisions to know what to attack and what to tolerate and adapt to. This is truly a very complex function and a very clinically important function too. The cellular army. Neutrophils. Neutrophils are the most abundant white blood cells in the body. In fact, at any given point in time, there are billions of neutrophils present in our body. They are also reflected in full blood count test or complete blood count test. We can get to know how much percentage we have in our body. These are very effective cells. They reach to the site of infection or injury fastest within minutes and start their action. They can kill the pathogens either by engulfing them or by release of toxins called free radicals or by producing nets of proteins which can trap them. They're very short-lived and they soon die after they have completed the task, forming pus in the body. Clinicians who treat infections, inflammation, or cancer often keep a close watch on the neutrophil count in the body. If it drops below a certain percentage, it's really concerning. Macrophages. Macrophages are large, longer-living immune cells. In fact, every organ has its own tissue-resident macrophages. They are highly versatile by function. They can engulf the bacteria, they can clear the cellular debris or the dead cells. They also help in presenting the antigen to the T cells, and they secrete important cytokines, which are chemical messengers that orchestrate a lot of immune phenomena. What is very interesting about macrophages is that they change their roles depending upon the context. M1 macrophages are pro-inflammatory, that is, they push towards destruction of the pathogens by mounting inflammatory response. Whereas M2 macrophages are completely the opposite. They are anti-inflammatory and are towards pro-repair or pro-resolution. This M1-M2 shift is very significant, and a number of lifestyle and drugs partly work on this shift. Dendritic cells. Dendritic cells act as intelligence officers. These intelligent tiny cells reside in skin, gut, and airways and continuously sample the environment looking for pathogens. As soon as they identify the pathogens, they break them down into small fragments of proteins and they mount them on their surface and approach the nearest lymph node. In the lymph nodes, they present the antigens to the T cells, thereby activating them. They also have a special function in the gut. Here, they present to the T cells harmless food antigens and help them develop tolerance to this. Without these clever cells, we would have developed food allergies. Natural killer cells, the assassins. These cells are very effective in killing viral infected cells or tumor infected cells. These cells identify the MHC molecules, which we have heard are the identity cards of the body. If there is any irregularity in the display of MHC molecules on the surface of the cells, they identify them and destroy them. Mast cells and basophils. These are responsible for emergency flares. These cells reside in blood, gut, skin, and airways. They are responsible for reactions such as asthma and allergies. When challenged by infection, allergies, or other physical stimuli, they release small packets of granules called histamine into the system. Histamine is very potent and within seconds can cause blood vessel dilatation, mucus secretion, and smooth muscle narrowing. This leads to symptoms that are seen in asthma and allergy. The only difference being in asthma and allergy, these get triggered by harmless antigens. Adaptive immune cells, lymphocytes, B cells and T cells are very potent immune cells in our system. B cells have got special receptors on their surfaces which can identify a particular antigen with great specificity. B cells, when mature, produce what we call antibodies or immunoglobulins. These Y-shaped particles can get attached to the surface of the pathogens and prevent them from binding to the body cells. These antibodies can also kill the pathogens with the help of complement system and natural killer cells. The very same antibodies can also turn against us and cause autoimmunity. Since B cells have got such high role in the production of autoimmunity, there are many medications now available which target B cells in clinical practice. Immunoglobulins are of 4 kinds: IgA, IgM, IgG, IgE. IgG is the most abundant. IgM forms first in the body in response to the trigger. IgA is found in saliva, gut, and breast milk. This really shows how important breast milk is to the newborn because they get a high amount of immunoglobulins through mother's breast milk. IgE is very much in connection with allergic disorders and can be found on the surface of mast cells. All of these immunoglobulins can be measured in the blood, and in fact in clinical practice, many times these get measured to see what's the level of immunity. If it's very low, it's concerning, which means that they are very, very vulnerable for infections. Immunoglobulins can also be given therapeutically in clinical practice and is in fact used in many circumstances. B cell has got yet another function. It can mature into memory B cells, which can remain in the system for a very long time. Memory B cells are formed once the infection gets over so that it can hold the memory of the infection, and next time around when the same pathogen attacks our body, the system is really highly effective in combating it. T cells are the commanders of our immune system. They are highly potent in killing the pathogens, but they don't get activated randomly. They need antigens to be presented to them through MHC molecules, so their action is very precise, very direct, and very potent. T cells are further differentiated as T helper cells, cytotoxic T cells, regulatory T cells, and memory T cells. T helper cells, these cells are further subdifferentiated as Th1, Th2, and Th17. Th1 cells are effective against viruses and bacteria. Th2 cells are effective against parasitic infections as well as they drive the allergy. Th17 is the driver of inflammation and very relevant for autoimmune conditions such as psoriasis, ankylosing spondylitis, multiple sclerosis. Cytotoxic T cells. Cytotoxic T cells are super killers in the body. In fact, T cells scan every single nucleated cell in the body looking for their MHC display. MHC, as we have learned earlier, are the identity cards of the body. If the cells display a tampered MHC or they have foreign peptides in them or viral elements in them, they immediately kill the cells using perforins. This type of killing the pathogens is utilized in viral infections such as flu, COVID, etc. T regulatory cells or Treg cells, these are the peacekeepers of our immune system. These special cells have a very clinically important role. They dampen and suppress the immune responses and prevent the responses from going too far and causing hyperinflammation. Hyperinflammation can be counterproductive and in some cases can be fatal as well. These peacekeeper cells suppress and dampen the immune responses. They achieve this by secreting cytokines, which are chemical messengers that facilitate the immune processes in the body. Cytokines can be pro-inflammatory or anti-inflammatory. They are secreted by various immune cells, and depending on the context and what is the requirement, they change their roles. If the function of the T regulatory cells are impaired or if the numbers are very low, then this can be a reason for developing autoimmunity as well. Memory T cells. Soon after the infection, a lot of T cells die. A proportion of T cells survive as memory T cells. These cells help in surveillance maintenance. If the pathogen is to attack once again, it remembers it by memory and kickstarts the machinery within hours. This concept is utilized in vaccine making. Molecular language of immune system. Cytokines and MHC molecules are kind of molecular languages used by immune system. Cytokines are small signaling proteins that get released by various immune cells. They can be pro-inflammatory or anti-inflammatory. Each of the cytokine can have a specific message for the immune system, such as grow, die, more inflammation required, suppress the inflammation, recruit more, switch, etc. In some of the inflammatory and autoimmune conditions, these cytokines are highly active and need to be contained. There are biological agents or medications now available to bring these cytokines under control. MHC molecules or major histocompatibility complex molecules, as mentioned before, these are the identity cards of the body. They carry specific immune molecular signatures in the form of protein particles on the cell surfaces that characterize each body. In the human body, MHC molecules are also known by the name of HLA, human leukocyte antigen. There are variants of HLA that can be passed on through generations, and these remain the most important genetic determinants of certain autoimmune conditions, such as celiac disease, ankylosing spondylitis, psoriasis, etc. Some of the important HLAs in the autoimmune world are HLA-B5, HLA-B27, HLA-DR4. Complement system. Complement system is yet another useful aspect of the immune system which is involved in direct killing of the pathogens. These complements form a certain membrane complex on the surface of the pathogens, drill the holes in them and kill them. In certain autoimmune conditions such as lupus, these are very low and they can then predispose the patients to dangerous infections. And finally, let me give an example of how all of this is orchestrated in the face of an infection in the body. Let me take an example of a bacterial infection. Streptococcus is a bacteria that commonly causes sore throat. Let's look at the timelines as well. The first 0 to 30 minutes. Through breathing air, the bacteria lands on the respiratory mucosa or the airway mucosa. Here, the bacteria tries to gain access to the epithelial cells, attaches to them, and wants to multiply. The tissue-resident macrophages as well as dendritic cells identify a foreign invasion and spring into action. They start killing the pathogens by release of cytokines and by direct attack. Nearby mast cells also are activated and they release histamine. Histamine is a potent vasodilator, which means it dilates the blood vessels and causes swelling, increased warmth, redness, pain. These are all the signs of inflammation. By this stage, you are already experiencing sore throat. Complements also get activated. They form the membrane complexes on the bacteria and start punching holes in them and killing them. All of this happens in the first 30 minutes of the invasion by bacteria. The next 1 to 6 hours, neutrophils, which are the most abundant immune cells, are floating in the blood vessels. As soon as they receive the alarm through the cytokines, they seep out of the blood vessels into the tissues. They start attacking the bacteria which are coated by the complement system and try killing them. In the process, they die as well and form pus. This can be seen on the tonsils. The next 6 hours to 3 days timeline. Dendritic cells, which are now fighting the bacteria, sample the bacterial antigens. They break them down as small protein fragments and display them on MHC molecules, go to the nearby lymph node and present them to the T cells there. Here the helper T cells identifies this specific antigen, comes into action, differentiates as Th1 and helps kill the pathogen. Meanwhile, they also release certain cytokines which activates or alerts the B cells to produce antibodies. Day 3 to day 10. The antibodies that get formed come to the area of infection and try and neutralize all the pathogens that are still circulating. T cells are master killer cells. They will also destroy the cells of our body which are infested already by bacteria. Once the bacterial load comes down, resolution begins. Most of the immune cells go back to their baseline. The dead cells and cellular debris are slowly cleared from the body and the repair work begins. By now, the fever has resolved, the pain and swelling has come down, and there is improvement in the clinical condition. Now is the work of memory B cells and T cells. Most of the B cells and T cells die in the process. A subset of them now change themselves into memory cells and remain active in surveillance. Should this bacteria invade once again, the response is going to be sharper and more effective. Whilst infection comes to close in majority of the patients, there's a small twist in tail for some. Here, the antibodies that are formed by the B cells against the streptococcus starts attacking the patient's own tissues such as joints and walls of the heart due to molecular mimicry. Molecular mimicry is a mechanism where protein sequences in the patient resembles that of the bacteria, and due to this, the inflammation continues. Because of this, there is continuation of fever and joint pain. This looks very different from the initial infection. This inflammatory disorder in children is called rheumatic fever. This needs to be identified early and treated differently. Thank you for staying with me all throughout this episode. I hope this talk gave you an insight as to how exquisite and intelligent our immune system is. I truly believe that this knowledge will change the way you see yourself as well as the diseases and reports. If you'd like to know more about the interactions between the immune system and health, please subscribe. Also kindly share it with others who may find this information useful. Until next time, take care of yourself.